Hi, everyone. I wanted to give you a short summary of the organizational ethics case conflict. Not just, and it's not really presenting the instructions for the synopsis or the presentation, but to provide you with an example. Um, because in your teams, I'm going to ask you to choose an example, a real world example from one of your teammates. So there's just going to be one conflict per team. And what I'd like to do is just walk you through this so you can get a sense of it. So each team is tasked with summarizing an agreed upon case conflict from a healthcare workplace. So that could be a current work environment, a previous one, or perhaps a conflict that you have witnessed at a healthcare environment that you go to, like your dentist's office. I think when I give my example, it'll become a bit more clear. This is a conflict that you've either been involved in individually or you were a witness to. So certainly you don't have to share all kinds of sensitive data. It's really the big picture of the conflict that you and your team are going to be working on. So let me share my example that I consistently use as an organizational ethics case and conflict to give you a sense. Okay, so this example is from a number of years back. It's actually not in the Southern Indiana region, but because of my background, I've had the privilege of serving on ethics committees for hospitals, health systems, regional type organizations in the past. And so I wanted to share my example actually comes from a discussion I had with a physician, and it actually took the scope of two meetings, but I'll share with you everything and the conflict that I really wanted to identify. So at the end of an ethics committee meeting, I had an opportunity to speak with a OBGYN who was on the committee. Now, let me describe her. She is lots of years of experience. She is prominent in the health system and in the region. Let's just say that she's a force. She is absolutely a force to be reckoned with, absolutely adored and respected by her patients. And we were talking about some, I can't remember the context of the discussion during the meeting, but this discussion with the OBGYN happened after the meeting. And she just gave me an example. The example is right now she is seeing, there's a patient that she's seeing, one of her longstanding patients, 35-year-old woman, and this physician has delivered her two children. So she's known her for a number of years. But the woman presented to her with increased vaginal bleeding, and after some diagnosis and some tests, it was determined that the woman had uterine fibroids. So here is my uterine fibroids example, which I conveniently borrowed from Medline Plus, not knowing anything about uterine fibroids myself. Some of you are much more knowledgeable than I am. These are non-cancerous tumors. They can occur in a variety of regions in the uterus. And the first sign of it for most women is increased bleeding. And so there's a variety of treatment mechanisms. There's medication. There is a removal of the actual tumors or fibroid tumors, how many, however many they are. And usually it's I say usually, apparently, according to the OBGYN, this occurs quite frequently, especially for women who have already had children. And but there's a third treatment option, which is hysterectomy, your removal of the uterus. Now, the first option, medication, is the least invasive. The next, a little bit more invasive, is removal of the actual tumors, and the most invasive is a hysterectomy. The third option, the hysterectomy, of course, will remove the uterine fibroids forever, but it comes with a few caveats, meaning that there can be no more children. And so this physician is explaining this to me, and this is where I'm going to take some notes down if it's okay. So I didn't even understand what the ethical issue was or why she was presenting it to me, and except that I knew that she trusted me. And so I'm going to write on this. So then the physician says to me, this 35-year-old woman, her two children are from two different fathers. And she came to me because she had met a new boyfriend, and she really wanted to have a good relationship with this new boyfriend. And so the physician presented all the three options to her, and in terms of treatment. Uh, and so there was certainly informed consent. Um, that it was never any issue of not presenting all the options. But then the physician says to me, and this is the line that I want you to pay attention to. She said, "I'm going to take out that woman's uterus because she shouldn't be having any more babies. I'm going to take out the woman's uterus because she shouldn't be having any more babies." So that came as a shock to me as well. And I, of course, not being a clinician, didn't have sort of the wherewithal to challenge her. Um, but there was just something that, I felt very strange. In fact, it presented a conflict for me. First of all, should I challenge the physician? I don't know anymore. I certainly don't know the patient, the woman in question. Um, I am led to believe after that statement that she didn't want this woman to have any more babies by a different man for a variety of reasons. She had the power to suggest the hysterectomy. Certainly, the hysterectomy is a more than acceptable treatment for the uterine fibroids. But was she imposing her sense of paternalism? Doctor knows best. Or was she just saying, you know what, I'm going to do this, and it accomplishes a number of different things? So I knew that the following week we were going to have another follow-up meeting, and I was thinking, should I ask this physician something? Should I challenge her? And again, the physician was there at the meeting. We had our meeting, and afterwards, I said to her, "Hey, you presented to me last week the case of the woman who had uterine fibroids, and you were going to do something about it." And she said yes, and I was actually thinking maybe I should question her on that statement. The statement, "I'm going to take out this woman's uterus. She shouldn't have it. She shouldn't be having any more babies." So I asked, "Well, what's happened in the last week?" And without missing a beat, she said, "I took out her uterus." And so I paused, just like I'm pausing now. I thinking, well, I guess that's the end of it. A few things happened. In summary, one is the woman doesn't have any more uterine fibroids. Um, Now, I have no doubt that the physician explained all the options, but perhaps, when the question came up or it was brought up, how can you ensure that you don't have uterine fibroids in the future? The only sure way is through a hysterectomy, understanding the consequences, of course. And yet, from my perspective, this conflict, I don't know if it was over or it just sort of went away. I present this case to you, and that's really where we are. I never said anything to the physician. I obviously don't know any more. I don't know who the woman was. I've shared this story a few times with different MHA ethics classes because nobody else knows about it. Um, the woman in question, although this was a few years ago, doesn't know that, to my knowledge, that the physician made this comment to me. And so sort of left with it. This is the case conflict that I wanted to share with you, just to give you a flavor, an example. Now, again, it's nothing that I'm involved in directly. I was more of a witness to it, but it's an organizational ethics conflict. Why is that? Well, certainly it was a conflict between, um, at least from my perspective, uh, the physician, perhaps certainly the woman as well. But was she imposing her sense of authority? I think so. I don't know for sure. Um, was there anything that I could do about it? Maybe not. Did it impact the organization? I don't know. Although this is just an example of how you might sense, again, it doesn't have to be necessarily clinically related. It could be organizationally related, um, insurance related. But this is the type of example that I'd like you to think about. Okay. So I'm going to stop right there. And certainly, as the teams are moving ahead, we can keep talking about it. But please use and rewatch this example as you and your team start thinking about one example for your team. Okay. All right. Thanks very much, folks. Bye.